Hello, I'm Yair Saperstein, and I am the CEO of avoMD. avoMD is building virtual clinical consultants. The problem that we're solving is the knowledge challenge. As a clinician, it's very difficult for me to be able to access all of the medical information that I need at the point of care to really be able to treat my patients the way that I need to. And it's not just my problem, it's a public health crisis leading to substandard care, wasted healthcare spend, and unfortunately, medical errors. Our solution is that we bridge the gap between the clinical evidence and localized care. Through our software, we transform the clinical evidence into a virtual clinical consultant that can help clinicians like myself actually provide effective localized care. Let me show you how it works. So here's an example to be able to treat depression like an expert. Let's say you're a primary care provider. We partnered with Columbia Psychiatry to be able to provide this information. Let me click into Accelerated Sequential Antidepressant Protocol, ASAP. As I click into the protocol, you can see that it has the medication library of these 7 essential meds that you need to effectively treat outpatient depression. If I click on one, it has titration, side effects, even the FDA label. Let me hit X. As I continue down, let's say it's initial management for my patient. I can use a depression severity calculator or just choose mild to moderate for my patient, knowing what my patient's depression severity is. I assess the suicide risk. Let's say it's passive suicidal ideation. So let me click on passive. And I see a note for passive suicidal ideation and what I need to do, followed by my initial bipolar screen. Let's say my patient is actually negative on the bipolar screen. Let's say they're 18 years old. I get a little warning about the black box warning for antidepressants with regards to suicidality. And then I have my step 1, sertraline or psychotherapy, where if I click on that, I get titration, I get more information that I need, and I can continue onwards. And it's not really just for depression, it's actually for any clinical content that can be relevant at the point of care. And the way that it works and the way that content is transformed into our virtual clinical consultant is through our builder. Our builder is a no-code tool, meaning that you don't need to know any programming to be able to use it to effectively allow for the expert clinicians to be able to put that content into virtual clinical consultant form. Our key offerings, therefore, are that we allow for custom or best-in-class content, meaning you can have, let's say, the Columbia Depression module, or you can have your own organization's content. It can be standalone or with EHR integration. If it's standalone, next day launch, no IT resources required. With EHR integration, it fits even better into the workflow. Clinical analytics to be able to get who's using it, which modules are they using, and be able to tie that into outcomes and understand how guideline usage affects outcomes. And last but not least is the marketplace, the ability for institutions to monetize their content into that off-the-shelf or best-in-class content that we then sell to further institutions and take a revenue share from that. The way that we work for EHR integration, we are Smart on Fire compatible, actually have one live site partnership with Samsung Medical Center, and are now doing a pilot with an Epic integration in Mount Sinai's instance. Our value proposition, we've been able to show that we can improve clinical accuracy and standardization. We have over a 10 times increase in pathway usage in one of our live sites. A randomized clinical trial that was done independently showed a 20% improvement in diagnostic accuracy. We've been able to show efficiency gains of time saved. For clinicians, the best thing you can give them back is their time. We have seamless workflow integration, a high clinician satisfaction, and they're able to offer CME credits for the clinicians and physicians that are using our content. We were founded in 2018 and have then grown over the last years, having raised $4 million, expanding our team, integrating into multiple hospital systems, and completed our builder. We have a nice array of customers, as well as supporters and partners, who we thank for supporting both in financial ways, as well as in content partnerships. We're addressing the clinical decision support market, which is now a $7 billion market and expected to grow because of increased regulations for the use of clinical decision support, as well as increased interoperability with systems speaking to each other. We have clear market advantages over our competition. Our competition is either workflow optimization, like order sets within the EHRs, or is educational, like reference tools, like UpToDate. But we're at the nexus of the two of them to allow for optimization of clinical care while also educating and empowering physicians at the point of care. We also have the team to make it happen. PJ is a professional developer, dual board certified, and attending at Harvard, and our product visionary. I'm the CEO, and I have an MD and an MPH, and really an understanding of the system. Lawrence has worked in private equity investing over the past 5 years before joining us, and has his MBA from Columbia. We also have a stellar team for content management, sales, and really development and product management. We are avoMD. Enhance your clinical decision support, improve patient care. Thank you for joining.